Hi, my name is Marcia Smith. I did my internship for BYU-Idaho for Marriage and Family Studies at University Behavioral Health of Denton, which is also known as UBH. This is a psych hospital for patients who are suicidal, homicidal, or have chemical dependency. And they evaluate patients for a few days and send them to another program where they need to be treated. They have an adolescent center, a military program, an adult unit, a day hospital or outpatient services, and I worked on the adolescent center. Why did I choose this internship? I was looking for an internship that was hands-on. Most of the other programs wanted people on a master's degree level. It was really hard to find somebody that would take a bachelor's degree level. Plus, I know that I want to help those with lost hope and broken hearts and stuff, and so I thought this would be a great opportunity. How I found it is I was searching the internet for therapist internship on a bachelor degree level, and I saw this position at UBH. The job posting read, UBH of Denton is currently seeking a bachelor's master's level program therapist interns to be a part of our social services team at UBH Denton. We work with patients ages 13 and up with a variety of mental health and substance abuse issues. Our inpatient facility is open 24/7 and internship opportunities are available each day of the week. Position description. UBH Denton will provide students with the opportunity to learn and practice skills in the areas of needs assessment, client engagement, clinical documentation, and making community referrals. Students will also have the opportunity to practice their clinical skills in face-to-face counseling sessions with clients in a strengths-based, client-centered setting. Students will receive weekly supervision with a licensed professional in their area of study. Whenever I applied for this job, I thought that I was coming in for an interview whenever I got a scheduled appointment, and a whole lot of other people did too. And a lot of people showed up at the same time, and they brought us to a room with tables and computers and set us down and told us how it worked and what would be expected and stuff, and asked us if we were still interested in the position, and so all of us got an internship. What were my responsibilities in the internship? Gather professional resources for the therapy binder, gather professional resources for the nurses station treatment binder, gather information for the behavioral challenge binder, help with facilitation of psych education group, attend some of the process groups. I didn't get to attend all of them because I'm not on a master's degree level. And I kept track of group numbers for active treatment binder. I also did biopsychosocials with patients and supervised patients when they fill out CABAs. The biopsychosocials are questionnaires that ask patients questions like the history of psychological disorders and their substance abuse, and questions about their family's history, substance abuse, psych disorders. If they have suicide in their family and what kind of drugs they take and stuff like that. The CABAs are things that patients have to fill out, and they have to use a pen. The patients aren't normally allowed pens because they could be dangerous with suicidal and homicidal patients. They usually just have markers to use things, but whenever they fill out this, they have to use a pen, and so we have to supervise them and make sure they're safe. My other responsibility was to help the therapist and director with whatever else they needed, like making copies and stuff like that. How did I benefit UBH? I help the therapists have good research available to help patients. I even made a suggestion that some of the patients needed better boundaries, and that was used. I put together a binder for therapy and for the nurses station. I made a binder with challenge packets with different subjects that therapists can use to give patients to improve on specific areas that they need help with. I helped therapists get things done so that they could have time to work on other things. How did UBH benefit me? I gained experience doing biopsychosocials and CABAs. I have experience gathering good research for teaching mental health. Have applied therapeutic principles to myself and know what areas I need to work on in improving myself. I've learned a lot about therapy. I have a deeper understanding of how everyone's life situation and challenges are so unique. I have more empathy and love for every individual person I come in contact with. I feel like I've grown and learned a whole lot in this internship. An important connection between my coursework and what I experienced during my internship. By small and simple things are great things brought to pass. Alma 37:6. Learning how to help people and helping them helps us at the same time, as we are willing to love others and see them as Heavenly Father sees them. The more knowledge we have, the better we are able to improve ourselves and to help others. In one of my classes at BYU, we learned that sometimes the person acting out is the healthier one that is having trouble with the dysfunction is a cry for help. And sometimes it's not. Sometimes it's the other person. But I saw this in at least one of the patients. I've seen patients from different varieties of backgrounds. And a lot of these children come from very hard backgrounds. In one of our classes, we were taught a story about turkeys learning how to fly. And at the end of the lesson, they all walked home. So when I first heard this, I was like, why would you do that? That's ridiculous. But then I realized that I have done this before in my own life because I didn't learn things before on the same level that I've learned it now. So I realized we're not truly, at different times in our lives, we're ready to hear different things and understand them on different levels and apply them in different areas. So sometimes we'll be trying to teach people and they just aren't ready to learn the material on the same level as what we would like them to understand it on. And nature versus nurture, we learned that different philosophers have different ideas as to what makes up someone's behavior. Working at UBH, I observed children from different types of families, and I have my own experiences that I see that nature and nurture influence everyone. I feel that we all have potential to improve and become like Heavenly Father as long as we're alive. And we need to remember that and see everyone's value and try to help them as much as possible. Would I recommend this site or experience to other students? There's positives and negatives, so it depends on what you're looking for. I thought it was positive that I got the hours I wanted, and I got to choose how many hours I wanted to work in the week, and I could work around my work schedule. The orientation was set up quickly so I could get started on my internship really fast because it took me a while to find one. The director is nice and helpful, and he stays in contact with you and asks if you have any questions and teaches as you go along, and he gives you projects to keep you busy. The therapists are nice, and I learned a lot. I liked attending the psych education groups, and I got to teach one. It would be very beneficial on a master's degree. I mean, it's beneficial on a bachelor degree level, but it would be even better on a master's degree level because then you get to participate a little bit more than I got to. Negatives is having to use a key for all the doors. The group rooms were cold, but on the last day that I worked, it was too hot, so I think they're trying to fix that. There's a big risk to being exposed to diseases because a lot of those patients have diseases. There's a lot of foul language. You are limited on what you can do on a bachelor level. Who should you contact to arrange an internship similar to this? Rocky Martin is the Director of Adolescent Services, and his number is 940-320-8123, or you can call 1-888-320-8101.